Altered elimination. The areas that we're going to be looking at are altered mobility within the urinary structure, the renal structure, altered neuromuscular function, altered patency, and altered perfusion. Changes in any one of these is going to alter the ability of the individual to excrete urine, which is then going to affect their body fluid balance. First is altered mobility. If urine isn't constantly moving forward, stasis results. It's pooled somewhere, not moving on. When I think of this, I think of a stagnant pond. You have water in your backyard, out in the field, wherever, that's not moving. You get all kinds of undesirable things growing in there. Well, the same thing's going to happen if urine stays in one place. All kinds of undesirable things are going to happen. Now that includes changing the reabsorption and secretion patterns of the filtrate. Fluid trapped in the renal system continues to be reabsorbed. So we're continuously getting more and more water shifting back into the body rather than being eliminated. Regardless of what the body needs, this fluid is getting shoved back into the body. Urine will get increasingly darker, so it's going to have a stronger smell and a darker odor. The components in the urine are going to precipitate out. They're going to fall out. We're going to start to see a cloudy urine because the components are falling out of solution. Think back to your chemistry class. And these little particles are going to cause obstructions. And also with this altered mobility, this stasis, we have an increased risk for infection. The next one is altered neuromuscular function. Either the nerve signal can't get through to tell the bladder and the whole renal system what to do, or the muscles can't respond effectively. If this is happening, we're going to interrupt peristalsis. The urine and the filtrate isn't moving forward efficiently, and then we've got this problem of altered mobility, like we just talked about, the stasis. Or we may have an interruption with the detrusor muscle and or the sphincters. That's going to interrupt excretion. Either the urine is going to be retained in the bladder, the person can't get the message through their brain to urinate, or we're going to have some incontinence. Altered perfusion. That's inadequate blood supply to the kidney tissues. The picture on this screen, you see some of the vascularization of the kidney. In real life, the vascularization is all over the kidney. There are no areas that aren't highly vascularized. What can cause a block in the blood supply? Well, it can be excessive vasoconstriction. It can be inadequate blood volume throughout the body. An obstruction of the arterial supply, or infection. And what are our consequences going to be? Well, if we block the perfusion to any part of the body, we end up with ischemia and infarction and damage, and that includes the kidney. And there will be pain. Altered patency. That's blockage of structures. That's obstruction. And in this case, we're talking about the blockage of the urinary structures, not the blood flow. That was perfusion, when we talked about perfusion. Now we're talking about patency of the renal system itself. What happens when we have problems with patency? We're going to have, well, the consequences depend on how bad is the blockage. Is it just one tiny little blockage, or is it blocked all over the kidneys? And we're going to have impaired perfusion perhaps, because the blockage may be pushing on the vascular beds. We're going to have structural damage, and a lot of that is because the structures above the obstruction are dilated. We're having urine and the filtrate and everything else trapped and pooled higher up in the urinary system, can't get through. Well, anytime you have stuff trapped, it causes pressure, and pressure can cause damage. Manifestations of altered elimination. Regardless of the cause, there are several things that are common. One, we're going to see changes in the volume and the characteristics of the urine itself. Maybe too much urine, maybe not enough urine, maybe a change in the odor, maybe a change in what's in it when we do urine tests. We might see bleeding. We're probably going to see pain of some sort. Now, colic is a type of pain. It is acute, intermittent, radiating, and it is excruciating. And then we have a type of pain called non-colic. It is dull, it's deep. Again, it might come and go, might change in intensity. And this is where we see CVA tenderness, costovertebral angle tenderness. And I'm going to show you some pictures of that in just a minute. We're probably going to see some distension of some of the organs in many of these problems. Swelling, filling up of fluids, so we may have some swelling, some distension of the organs. We might see anorexia, nausea, and vomiting. Remember, we've got some fluid and electrolyte imbalances going on. And we might see fever, which indicates we probably got an infection. Alright, so here we're going to talk about costovertebral angle. We have the straight line here, vertical line, which is the vertebral column or the spine. Then we've got the costal border, which is the ribs, the bottom of the rib cage. So where those two come together, that's your costovertebral angle. And if you can thump very gently with the side of your fist, very gently with the side of your fist, kind of rattles things around a little bit in there. And if we have any kind of kidney infection or distension of the renal structures, this is going to be very painful. And this is one of the ways you can assess for that non-colic pain.